Hello people, welcome to Crazy Farm, and in this video we will be looking at the mechanism of action, uses and adverse effects of amphotericin B and also a few points on the antifungal agent flucytosine. First, let us see the mechanism of action of amphotericin B. Amphotericin B interacts with the ergosterol which is present in the fungal cell membrane. It has some affinity towards the ergosterol which is present in the fungal cell membrane, and it forms numerous pores in the fungal cell membrane through which there is loss of electrolytes like potassium, etc., which will lead to fungal cell death. This is the mechanism of action of amphotericin B. Now, coming to the uses. It is an antifungal agent with a very broad spectrum of action, and it is used in nearly all life-threatening systemic fungal infections. Especially, it is used during the initial induction regimen to rapidly reduce the fungal burden. And once the fungal burden has been reduced, amphotericin B is usually replaced with other drugs like azoles. The reason being, even though amphotericin B is a highly effective drug, amphotericin B has certain adverse effects for which after the initial induction regimen with amphotericin B, it is replaced by the newer azoles, which have less systemic toxicity. Now, intravenous administration of amphotericin B can be done for the treatment of systemic mycosis, and in case of cryptococcal meningitis, any forms of meningitis, intrathecal administration of amphotericin B is preferred because amphotericin B has poor penetration into the CSF if given intravenously. So it has to be administered intrathecally for that purpose. And topical application of amphotericin B can be done for mycotic corneal ulcers, and for fungal arthritis, intra-articular injections of amphotericin B can be given. One interesting point about amphotericin B is that apart from being an excellent antifungal agent, it also has activity against leishmania. That is why it's used for leishmaniasis as well. Now, coming to the adverse effects of amphotericin B. We can broadly classify the adverse effect into infusion-related toxicity and cumulative toxicity. Infusion-related toxicity can be seen during the infusion of amphotericin B or within minutes of infusion of amphotericin B. And it is characterized by fevers, chills, spasm, hypotension, headache, vomiting. So all these symptoms can be seen during IV administration of amphotericin B. So what can be done to prevent this? Pre-medication with non-steroidal anti-inflammatory drugs like acetaminophen or paracetamol, ibuprofen, or steroids like hydrocortisone hemisuccinate can be done. So pre-medication with all these drugs can prevent all these infusion-related symptoms. One major side effect of amphotericin B is that it is highly nephrotoxic. Okay, this is a very important point, and it can cause azotemia, increase in serum urea levels. It can cause renal tubular acidosis. It can end up producing a number of electrolyte abnormalities like hypokalemia and hypomagnesemia. It can cause renal tubular damage, which can result in decreased erythropoietin production and anemia. All these are the nephrotoxic effects of amphotericin B. So what can be done? We can use less nephrotoxic formulation. That is, liposomal formulations are less nephrotoxic. So liposomal amphotericin B can be used. Or saline loading can also be done. Saline loading means administration of 1 liter saline on the day of treatment with amphotericin B. If the patient is able to tolerate that 1 liter of saline load, 1 liter of fluid load, then administration can be done. Administration of 1 liter saline can be done, and this also reduces the nephrotoxic side effect of amphotericin B. Now, let us see something about flucytosine. Now, this is the mechanism of action of flucytosine. Flucytosine will enter the fungal cell, and it is acted upon by cytosine deaminase enzyme, which converts flucytosine to 5-fluorouracil. And 5-fluorouracil becomes 5-fluorodeoxy-UMP, and this 5-fluorodeoxy-UMP will compete with deoxy-UMP for the binding site on thymidylate synthase. So it causes competitive inhibition of this step. due to competitive inhibition of this step, where deoxy-UMP cannot become deoxythymidine monophosphate, DTMP cannot be incorporated into the DNA. So this will result in inhibition of DNA synthesis. This is the mechanism of action of flucytosine. And one point is that it shows synergistic action with amphotericin B. Why is that? It's because of this, as you can see here, right? Amphotericin B will form pores in the fungal cell membrane, which will facilitate the entry of flucytosine, right? That is why flucytosine and amphotericin B exhibit synergistic action when administered together. Now, in cryptococcal infections, in cryptococcal meningitis, etc., the total dose of amphotericin B can be reduced by addition of flucytosine. Flucytosine, however, is not used as sole therapy due to fear of development of resistance. And therapy is usually limited to the first week of amphotericin B regimen because flucytosine can cause myelosuppression, because of which amphotericin B and flucytosine can be given during the first week, after which flucytosine should be stopped because of its fear of myelosuppression. So that's it for this video. Thank you, and if you like this video, please like, share and subscribe.